This is part 4 of chapter 9, and we're going to begin with mononucleosis. Infectious mononucleosis is also known as glandular fever, and it is caused by a virus called the Epstein-Barr virus, which is a herpes virus. The main symptoms of mononucleosis includes lymphadenopathy and fever. Lymphadenopathy, they usually have swelling of the cervical lymph glands and then even other lymph glands in the body. The person may have some really kind of vague symptoms, like just not feeling like eating, which is anorexia, chills, malaise. Eventually they develop a sore throat. There's a great picture in the book, gross picture, of tonsils coated with debris during an infection with mononucleosis. Mono is sometimes referred to the kissing disease because it's transmitted through the oral pharyngeal route, which would be through saliva. Also transmitted through blood transfusions, because it's caused by a very specific virus, the Epstein-Barr virus. After it's inside the body, the virus infects the white blood cells that are found in the lymph, blood, and connective tissue. The syndrome may also cause a mild hepatitis, an inflammation of the liver. Primarily affects adolescents and young adults. It's really rare after the age of 35. And treatment is symptomatic. There's no cure for it. It's caused by a virus. And certainly the person needs antipyretics to reduce the fever, and bed rest is an absolute when the person truly has mononucleosis. Fluid intake is very, very important to keep the person from becoming dehydrated. Next is the adult respiratory distress syndrome, which is also abbreviated ARDS and referred to as ARDS. Sudden onset of severe hypoxemia, progressive hypocapnia, and acidemia in the patient who has recently experienced trauma, septicemia, shock, or insult to the lungs or the rest of the body. The person that's going to develop ARDS usually has some really, really serious infection or really, really serious trauma, like burns over most of the body or severe head injuries. Primary symptoms: sudden and severe dyspnea, rapid and shallow respirations. The arterial blood gas will be drawn, and I talked in the very beginning in part 1 of this chapter about the use of arterial blood gas to determine respiratory failure. Certainly that is a fear of the person who is in ARDS, that they will develop full-blown respiratory failure. So treatment for the ARDS is treatment of all the underlying conditions, the severe infection, the trauma, and to try to get oxygen forced into the person. I want to talk a little bit about respiratory failure. Impairment of gas exchange between air and circulating blood, which could be due to ARDS. And there's a number of other conditions that I've talked about in this chapter that could result in respiratory failure. There's a problem with the blood receiving the oxygen that it needs and releasing the carbon dioxide that it needs. It could be a problem with just the person being able to breathe in and out, the chest wall muscles, or a problem within the brain that's causing them not to be able to physically breathe in and out. Or it could be a problem with the like the alveoli in emphysema or COPD or ARDS. Signs and symptoms of respiratory failure. These are not in the book. Distended neck veins, peripheral edema, which is edema of the hands and feet, arms and legs. Wheezing, poor air movement when the medical professional is listening to the person breathe with the stethoscope. They don't hear the air moving. low blood pressure, the hypotension, hypoxemia. They're not getting oxygen to their tissues and bloodstream. Tachycardia, tachypnea. They'll also develop central nervous system disturbances, headache, confusion, coma. I want you to note the arterial blood gases here. This is really important to note that if a person's in respiratory failure, the ABGs are going to show an oxygen saturation of less than 60 millimeters of mercury. The carbon dioxide blood saturation is going to be greater than 50 millimeters of mercury, and the pH and or a pH of less than 7.30. The whole thing going on here is that there's not enough oxygen in the bloodstream, hence a low PO2, less than 60. Too much carbon dioxide in the bloodstream, that high, greater than 50 carbon dioxide saturation. Those are the important figures to remember here to indicate respiratory failure. Treatment's going to depend on the cause and may include being placed on a ventilator, a respirator, mechanical ventilation. Infant respiratory distress syndrome. We looked at infant respiratory distress syndrome in one of the very earliest chapters of the book, and the childhood diseases, that a person that is born prematurely is more likely to have this hyaline membrane disease, also called newborn respiratory distress. Shortly after birth, they have signs of being in distress. Their nasal noses will flare, they'll grunt and have sternal retractions. And again, the premature infants are at greatest risk. Okay, looking at the carcinoma of the lungs, which is lung cancer. A person can have primary lung cancer, that would be where the cancer originates in the body, or the person may have metastasis to the lungs, that the cancer originates somewhere else in the body and spreads to the lungs. Also, a person could have a tumor of the lung that was benign, that was not even cancerous. Cigarette smoking is linked to 80% of the cases of carcinoma of the lung, 80% or more. The earliest stages are asymptomatic. The person doesn't even realize they have the cancer growing there. In later stages, they'll develop a persistent cough, wheezing, difficulty breathing, but they may not really pay attention to these symptoms because they probably already have some chronic bronchitis from cigarette smoking. They may develop, well, they will, in later stages, the bloody sputum, pain in the chest and the back. Lung cancer frequently spreads to other sites in the body. It frequently metastasizes to lymph nodes, liver, brain, bone marrow, and the adrenal glands. Unfortunately, the person's more likely to seek treatment after they have the symptoms of metastasis, like they develop the bone pain from the bone cancer, or they develop headaches from the brain cancer, because the cancer is spread to these other sites, and then they seek treatment for those other sites, and it's after the lung cancer has already progressed and metastasized to very often untreatable stages. Treatment, in some cases, part of the lung can be excised if it's not too far advanced. Certainly chemotherapy is used, and it depends on exactly which type of carcinoma of the lung, what treatment will be administered. One more condition that you've looked at before, again in the childhood diseases chapter, cystic fibrosis, an inherited disease involving exocrine glands characterized by abnormal secretion of mucus. The most serious manifestation will be the increased mucus production in the respiratory tract, resulting in obstruction of air passageways. Bronchiectasis infections are very common, and it's usually respiratory complications that cause death in a cystic fibrosis patient. Signs and symptoms: wheezing, persistent cough, thick sputum, and steatorrhea. Treatment: chest physiotherapy, antibiotics for the infections. Oh, so sorry, malfunction here. It's a problem. Treatment includes antibiotics, chest physiotherapy, and bronchodilators. This concludes the lecture of Chapter 9, the respiratory system.